Well, of course, the one that we know the most about in terms of the future of the Affordable Care Act is the one that's already been proposed in Congress called the American Health Care Act. And that one, it actually does build on the foundation of the Affordable Care Act, but it modifies certain things quite substantially. So it changes how tax credits are given in a way that does not take into account income. So it's simply based upon age and not about income. The idea behind that was to encourage more younger people to get enrolled in health coverage, but it does have an adverse effect on older people, sicker people, and low income people, particularly in areas that have high cost premiums. The other thing that was included in the American Health Care Act was a very fundamental change to the Medicaid program, in particular capping how much states would have to spend on Medicaid, limiting who could get enrolled, and giving states more flexibility to do some things at the state level that are really different than what we've done historically for Medicaid. These are really two fundamental principles that are at core of what's most been proposed with regard to changes to the Affordable Care Act. They are the idea that they want to get rid of this, what's very much described as the worst part of the Affordable Care Act, what's called the individual mandate, the requirement that people buy health coverage, and fundamentally change Medicaid to give more state flexibility, but really less funding for that program as well. So these are kind of the basic ways that have been discussed so far in terms of changes to the Affordable Care Act, at least in this current environment. But there are many other ideas that have been surfaced. And most of those ideas have to do with actual expansion of the Affordable Care Act. So if you talk to consumers, for example, what consumers are really saying that they want changed about the Affordable Care Act is not that they get less coverage, which ACA would really have provided, but rather that they get more financial support to afford coverage. So consumers want to have lower copays, lower deductibles, lower premiums, and more choice. And ideas around those things have to do with expanding coverage to include what's called a public option, where consumers could potentially buy into Medicare or Medicaid in areas where there's not enough competition, expanded subsidies, more support for health insurers to provide more reasonable premiums. So those are other ideas that have been talked about in terms of ways you could actually affect the Affordable Care Act. So, it's really quite interesting because when you do the polling data on the Affordable Care Act, at least historically, you saw a lot of unhappiness with that law. But what that polling data sometimes missed is some of that unhappiness was from a very large segment of the population that thought that the law didn't go far enough. And these are actually people who are strong advocates for a single-payer healthcare system, right? Healthcare financing system, kind of like you might see in Canada, Great Britain, or many other developed countries in the world. So there's a really lot of advocacy around the idea of single-payer coverage in healthcare. Medicare for all is kind of the term that I think a lot of people use when they talk about single payer. And recently, we actually have seen the polls supporting the idea of single payer increasing quite significantly. So now a plurality of Americans say that they actually support single payer healthcare. The challenge with that, of course, is that when those questions are asked, they're asked in a very high level, very general way. And it sounds great to people to say, yes, we want to have the government pay for our health coverage. We don't want to have to face the kinds of copays and deductibles and premiums that we experience. So yes, we'll be supportive of single payer. But when people actually start to talk about the details of what would be involved in single payer, higher taxes, all of the developed countries in the world who have a single payer structure pay much higher taxes than we do in the US. Some of the limits that get included in those programs to make those programs affordable in terms of how physicians and hospitals are paid, what's covered under those programs. Most countries have waiting lists for people to get services in some way, shape, or form, although their population health statistics are better than the US, so I'm not sure those waiting lists are actually a problem from a population health standpoint. But when people start to unpack those details, they get a little bit less favorable towards the idea of single payer. I think it would be enormously challenging for the U.S. to adopt a single-payer system politically. I still don't see the will there to do that, even though you get some of this polling data that's out there. It just doesn't fit with the American view of private enterprise, of competition. I think it would be very hard, especially in this Congress, to see any coming together around that idea. I think it would really take a very radical change in our governmental structure. maybe somewhere down the road. I think it would take a bigger crisis than we're in to move us to single payer. Americans by nature, American policy by nature is incremental. We tend not to blow up complete systems and go for wholesale change. We tend to build on existing systems, which is exactly what the Affordable Care Act did. And in fact, when we were discussing the Affordable Care Act, this idea of having a public option was included in that discussion. It would have enabled people to buy coverage from Medicare or Medicaid. And the opponents to that idea said, oh, that's a backdoor into a single payer. Now, I could see that concept coming back to give people more choice of health coverage, and maybe down the road it does provide more of our population covered by government programs. But I don't see it going directly to single payer as an overarching system, at least not in the near term. I think the big issue in the debate about healthcare is something that really hasn't been discussed, and that is the issue of what philosophically underpins the viewpoints of the different proposals and different perspectives that are out there about healthcare and what we should do as a country on health insurance. Fundamentally, the Freedom Caucus and many conservatives more generally believe that healthcare should be a market good. They actually don't believe that universal coverage should be a government goal. They think that the government should help make markets work effectively, but essentially it should be a consumer market. People should be buying health insurance themselves, and it should not necessarily be a market that's fundamentally subsidized by the government. So many conservatives, and I think generally the Freedom Caucus broadly, would like actually to simply repeal the Affordable Care Act and go back to the way it was before the Affordable Care Act was in effect. And that is the issue that we're not really discussing. We're not really discussing philosophically as a country, what is it that we believe should happen with healthcare? Is it a social good? Is it something that the government has an interest in assuring Americans have? Or is it purely a market good and should be regulated by like other consumer products in the market? And I think the Freedom Caucus believes it's a market good like any other consumer product. And I actually believe most people, if we polled citizens at large, actually believe it's a social good and should have public policy and government support included in providing health coverage. The Republicans got themselves into a box because when they were doing all this, let's just repeal and replace the Affordable Care Act, they described it, and particularly President Trump described it as an opportunity to make it better. And, everybody would love it. Those are the words that they use. We're going to provide coverage for everybody. We're going to make it lower cost. Well, consumers do not hear that to say that it'll go back to being a market good and you pay for it yourself and you get skimpier coverage. When consumers hear it's going to be cheaper and better and everyone will have access to it, to them, that means you're going to bring the cost to them down. Right? And that implies government involvement. So the Republicans got themselves into this box about repeal and replace because they took the rhetoric that says we want to have universal coverage, but their real conviction is we really don't want to have universal coverage. And that's why they're really struggling right now to come up with any coherent legislation that fits their true ideology, but also fits the marketing strategies that they've adopted to get to consumers, and they don't align.